net. Arguing for the end of adult marijuana prohibition is easy because we have facts, science, reason, compassion, evidence, truth, and logic on our side. It is even easier when researchers catalog it all for us. Learn how to gather the facts on marijuana use, arrests, seizures, rehabs, drug tests, and more in this edition of Drug War Data Mining.
All right, welcome back, everyone. 22 after the hour, and this weekend I decided to take the video from the No on 91 press conference and turn it into some Yes on 91 advertising. If you were watching it along with me the other day, we openly laughed at a few of the things being said by the No campaigners because they just didn't realize what they were saying really made the case for legalization. This first one will explain to you how desperate they are to try to scare us about marijuana in Oregon.
How desperate is the No on 91 campaign to scare you about marijuana?
A couple of things that he talks about is the advocates of this Measure 91 want you to believe that marijuana has medicinal value, which couldn't be anything further from the truth.
The truth is regulation is a better approach than prohibition. Vote yes on 91. This advertisement produced by the Russ Belville Show and is not sponsored or endorsed by the Yes on Measure 91 campaign.
I got to say, folks, you got to be really, really desperate to try to float the "there is no such thing as medical marijuana" balloon in Oregon, where we've had medical marijuana since 1998. We've got 69,000 patients, and twice our legislature has voted to expand medical marijuana. Now let's get to one of these where Connie Ramakers makes the point as to why we've got to legalize marijuana to save the children. I couldn't believe she actually said this at the press conference. Amazing.
A mom and grandma from No on Measure 91 explains why to vote yes on Measure 91.
I see what's happening with marijuana. The kids are telling me. They say within 5 minutes they can get marijuana. It's much easier than tobacco or alcohol to get into their hands.
Because drug dealers don't check ID. Vote yes on Measure 91. This advertisement produced by the Russ Belville Show and is not sponsored or endorsed by the Yes on Measure 91 campaign.
Yeah, it's something when the No campaign is using our talking points that it's easier for kids to score marijuana than alcohol and tobacco. I was stunned that they actually said that. We've also got Dr. Kimber Richter. She's a member of Project SAM's board of directors. And of course, Kevin Sibet flew her out there with all the talking points that she would need to help to defeat marijuana in Oregon.
Project SAM's Kimber Richter for the No on 91 campaign worries about marijuana's social cost.
We won't even be able to project what the public health harms will be. And the cost that we're seeing now, the $1 in tax revenue for the $10 in social costs, who knows where that's going to be with marijuana.
Colorado and Washington have made $45 million in tax revenue to date, yet nobody claims they've suffered $450 million in social costs. Learn the facts. Vote yes on Measure 91. This advertisement produced by the Russ Belville Show and is not sponsored or endorsed by the Yes on Measure 91 campaign.
Yes, the classic Sabbath conjecture, because toxic and addictive disease and violence-causing alcohol and tobacco cost $10 for every tax dollar they bring in. The same thing would be true for marijuana that's far less addictive, far less harmful. It just makes no sense for anyone that applies just the simplest bit of common sense to it. Now, in this next commercial, we get a drug rehab professional trying to scare us about all the teens in rehab for marijuana without realizing he's also making the case for legalization.
Drug treatment Dr. Ronald Schwartzler from the No on 91 campaign explains why to vote yes on Measure 91.
There is no adolescent treatment, by the way, in the state of Oregon. You cannot get your adolescent treated. You almost have to wait till they're 18. By then, the damage has been done.
Measure 91 devotes 25% of marijuana tax revenue to drug prevention, treatment, and mental health programs. Get the facts. Vote yes on 91. This advertisement produced by the Russ Belville Show and is not sponsored or endorsed by the Yes on Measure 91 campaign.
Of course, it's also important to recognize that 61% of the people in rehab for marijuana and a full 54% of those who are there for only marijuana were forced there by the criminal justice system. I'd be upset about losing 3 out of 5 of my forced customers too there, Dr. Ronald. All right, one more commercial. This one comes from Mandy Puckett herself, the drug rehabber, who is the spokesperson for the No on 91 campaign. Enjoy. Mandy Puckett, head of the No on Measure 91 campaign, worries about marijuana advertising.
Again, the biggest concern that we as moms have is how this is going to affect kids with mass commercialization, advertising, promoting, normalizing marijuana use. That's what comes along with Measure 91.
Measure 91, Section 7 grants the OLCC the power, quote, to regulate and prohibit